When it comes to health insurance and specifically supplemental health insurance, there's so much to consider. This morning, we continue learning more about these plans and how we can benefit from them. So joining me again is Kelly Rayburn from Willoughby. Welcome back.
Thank you.
All right, so last time we spoke a little bit, actually you gave us a lot of insight on supplemental health insurance. Give us a little refresher for today if possible.
So supplemental health insurance is really there to help cover any of the primary costs that insurance doesn't cover.
And a lot of people assume that all of these things will be covered, and they're not.
They're not. There's a lot of gaps in insurance, whether that's traditional group coverage or whether that's going to be in the senior market, and we're here to help fill those gaps with supplemental health.
So if you're thinking out there, I've got that insurance, listen up, you may need something else. So what do we need to think of?
So you may want to think about things like in the senior market, Medicare doesn't cover the dental routine visits and things like that. So they may want to be able to think about dental insurance, hospital indemnity. You may want to think about things for glasses, vision insurance, or hearing aids if you have hearing loss. It doesn't mean that they're not going to cover all the costs, but it's there to at least help cover some of the cleanings in dental, whether it's a root canal, so on and so forth. It just kind of helps cover the expenses, and it's getting more expensive as we age.
That's right. And as we age, we don't want to think about it, but things do pop up. I mean, I know you do Pilates. I'm a runner. We're in pretty good shape. But at the end of the day, when you start hitting, those high numbers, things start happening.
Yes.
And how do we prepare for that?
Well, plan now. Get it before you actually need it, because it's going to be less expensive right now in today's dollars than it will be as we get older. Some examples of those would be dental, hospital indemnity. Things to consider would be short-term care, so that you can either be covered for home health care or situations of a facility. Maybe you get diagnosed with cancer, and there's a lot of indirect costs that are associated with that diagnosis. So planning now really helps protect us as well as our finances.
Not something we really want to talk about or think about, but at the end of the day, it's better than the alternative, right?
Right.
So we need to be proactive.
Yes.
Thank you so much, Kelly. And if you want more information on any of this or on supplemental health insurance, just go to willoughby.com or check out our website, thebalancing act.com.